Anita Mugula has 4 children. Her oldest is 14 years old and her youngest is 8.
I have a right to produce more children, but only if I can manage them.
For now, she has no plans for an addition to her family. She tells us that the midwives who helped bring her children to life gave her this advice.
They told me to space and limit, wait until the first child started walking or after 3 to 4 years. I also realized that endless births weren't good.
The midwives advised her on a variety of family planning methods. She chose one.
I chose pills, and my husband isn't against them.
She's thankful to the midwives because by now, she says, she could have had 3 more babies. The role played by the midwives in her life often goes unmentioned. The Population Secretariat, which sees to the quality of the population, is impressed by their role in controlling the population growth rate.
First of all, in the provision of family planning information and services, this includes the counseling and service provision, whereby they have to administer the methods to the clients.
This requires them to be knowledgeable on the subject.
For them to be able to know what side effects to expect from the choice of method that they make.
Wahab Kafero knows that family planning will help space the children, but he feels the onus is upon the woman to practice family planning. He's glad that his wife delivered in hospital.
I'm not sure of which family planning methods she chose, but I know those midwives gave it to her.
Midwives have also been there in the birth journeys of Johnson Asimwe's wife, but the only family planning method he will allow is the use of condoms.
We do it like that because sometimes they have complications in the family pills or what. Maybe those injector plans I don't know about.
How many children do you have?
We have done work. So far we have 5 of them.
The oldest at 18 and the youngest at 7 months. He says he's committed to condoms for life. But she's your wife. You can't use condoms like forever.
No. We have to use it because I know her very well. We are too fertile. Once we do it, automatically.
According to Uganda's Population Secretariat, the National Policy for Social Transformation and Sustainable Development calls for increased information, decision-making, as well as the services or means for women and men who wish to space or limit their births. According to the 2011 Uganda Demographic and Health Survey, about 4 out of every 10 currently married women between 15 and 49 years, as well as 1 out of every 3 men either want no more children or have been sterilized. The desire to limit the number of children increased, though the percentage of planned births has decreased from 60% to 56% in 2011. The total fertility rate is 6 children per woman throughout her reproductive life. Some, however, exceed this number. The provision of adequate and accessible family planning services depends on the availability of the information.
When we talk about family planning, we are not saying that stop giving birth. It is important to stress that because family planning only helps you to plan for your family.
At Prime Medcare Clinic, they've hired a midwife for this purpose.
When we just started, we could have a number of mothers coming with the need to have antenatals done, the need to have family planning services.
Kotilda Yanawera is not a mother herself. Her knowledge on family planning is useful to the mothers who pay her a visit at the clinic.
You find that the biggest population will not go to a good health center where they will find adequate care. Most of these ladies actually who have so many children who have failed to adhere with family planning, they are from the rural areas where they probably have to go to a traditional birth attendant for help.
Yes, the midwives have an important role because they can actually decide to bias the women. Because if the clients come and they do not have the information, then the power lies in the hands of the midwife. They'll either give them the correct information, which they'll take on, and if they don't, they can still bias the women.
There is a dearth of midwives in the country. The government needs about 2,000 more. The private midwives want to set shop nearer homes of the people who really need their services, but they are limited by funds. All these limitations somehow contribute to the 3.2% growth rate of Uganda's population, translating into 1.2 million added people each year to a country whose resources are not in tandem with this increase. Flores Alimba, NTV.